Hey everyone, it's Nurse Steve, and today we're going to talk about how to listen to the lungs. To listen to the lungs, you need to have a stethoscope. When you're wearing the stethoscope, make sure that the ear parts are pointed forward, and you put it in your ear, and go ahead and tap it to make sure that it is working. When you are listening to the lungs, you're going to instruct your patient to take one full inspiration and expiration. So deep breath in, out. And every time they do one full respiration, you're gonna move your stethoscope to a different part of their chest and their back. I'm gonna use Klein here as a way to demonstrate where exactly on the chest you're gonna be measuring. For the sake of this demonstration, I'm gonna remove his shirt, but you do not need to remove the patient's shirt. When you're listening to the lungs on the front part, the anterior part of the body, you're going to listen to the lungs here, right above the nipple, below, right at the bottom of the ribs, and under, right here, under their arm. What you're trying to do is get to the top, middle, and bottom bases of the lungs. You want to compare the right and the left side to make sure that there's no abnormalities. They should sound the same. Inhale, exhale. Again, inhale, exhale. Again, inhale, exhale. You do that. Inhale, exhale. 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 When listening to the lungs posteriorly, you're going to listen around the scapula from top to bottom. So you're going to have them breathe in, out, breathe in, out. Go around the scapula, around the scapula, around the scapula. Okay. Oh my God. It's important to note that when you're listening to the lungs that you're not putting the stethoscope over bony prominences. You're not going to hear anything. And what you're trying to listen for is adventitious lung sounds. These are those crackles, rails, wheezing, those sounds that don't indicate that everything is clear to auscultation, right? There's something wrong with the bronchioles, maybe there's pneumonia, you're hearing some infiltrates, there's something going on with the lungs.